Oregon is continuing to see a growing number of coronavirus cases. Just today, there were 250 reported, and that's the second highest daily total since this pandemic began. And the state has some new predictions for the surge in cases. The actions we all take now in the next few weeks could make the difference between a few hundred new cases per day or a few thousand.
People stayed home and saved lives.
That's Oregon's health officer, Dr. Dean Seidlinger, praising Oregonians for flattening the curve early during the pandemic. But now there could be a shift.
We've been seeing increased transmission, increased cases since we started reopening.
Oregon's positive coronavirus testing rate more than doubled over the last month from 1.6% to 3.7%. That's not too bad, but the virus has potential to grow exponentially, and the state expects some serious growth over the next month. So there are three scenarios health officials are looking at. But first, let's look at the optimistic one. It assumes growing case numbers reflect more testing, not spreading. We'd see about 180 cases per day and 8 people going to the hospital. We'd end up with under 30,000 cumulative infections. But the state says this is all unlikely since a third of our cases now have not been traced to a source and more people are interacting.
And that planning tool shows us that those cases can increase fairly quickly the more people have contact with each other.
Here's the more likely moderate scenario. It projects a 10% increase in transmission between this month and next. We'd have about 300 new cases per day, which triples over the next month to 910. That means about 27 people headed to the hospital daily by next month. This scenario predicts just under 40,000 infections. Last, the pessimistic scenario. We'd see a 20% increase in transmission. 560 new daily cases would dramatically increase over the next month to nearly 5,000 per day. Hospitals would be flooded with 82 new patients daily. And Oregon would end up with about 80,000 infections.
If we ground ourselves in the science and ground ourselves in the data, we can come together and really have the best impact.
We can stop this exponential curve by maintaining distance, limiting travel and gatherings, washing hands, and wearing masks.
This isn't about left or right. This is about coming together to have a safer Oregon.
Last, if you get sick, stay home and answer calls from contact tracers.
What these calls do is they help us prevent the spread of the disease.
Best case scenario, you help save lives.